Using a gestational carrier, or what's commonly called a surrogate, can be a life-altering option to parenthood. I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. We're going to talk about what surrogacy is and why people use them. So first, what is surrogacy? And again, surrogacy is a lay term. It's really a gestational carrier. The difference being that a surrogate uses her own egg. A gestational carrier is not biologically related to the parents. So the people who are raising the child is called the intended parents, and the woman who's carrying the baby is the surrogate or gestational carrier. So it might be a single parent, it might be a couple. Either way, the carrier is going to be the woman who's being hired, or a family member or a friend who's carrying the pregnancy throughout the gestation. So who needs a surrogate? Traditionally, surrogacy was reserved for medical indications. So someone who's had failed implantation from embryo transfers and there's no clear reason why. Someone who's had recurring pregnancy loss and doesn't want to keep having this issue, so they go to a surrogate to carry their pregnancy. Maybe they have a medical reason for doing it, an underlying disease such as cancer or an autoimmune condition. Maybe they've lost their uterus and they aren't able to carry a pregnancy. Perhaps it's a same-sex couple, male couple, who can't obviously carry a pregnancy. But increasingly, we are seeing non-medical reasons, maybe a professional woman, an athlete, or a woman who can't afford to have time away from work. And so there are non-medical reasons for surrogacy that a lot of people are now considering as well. So how does surrogacy work? Sometimes a couple or an individual will come in knowing that they're going to be using a gestational carrier, and other times they don't know. They created embryos and they had no idea that they were going to need a surrogate. They tried to conceive using their own uterus and were unsuccessful, so they're doing it after the fact. But let's say that a couple knew that they needed a surrogate, or an individual knew they needed a surrogate up front. Either way, in vitro is a necessary part of that because we have to have the embryos created in order to replace them into another woman's uterus. Typically, there's an agency involved unless you're using a family or a friend, someone who's going to match you to a person to carry the pregnancy. And again, this is not legal in all states, and some states are more friendly with surrogacy. There's less complications once the child is born in terms of parenthood rights. California is a very friendly state, and surrogacy has been allowed in California for a very long time. And so depending on where you live, you may choose a surrogate outside of the state you reside. We certainly have patients coming from all over the world, from other countries where surrogacy may not be allowed. Some of the things you want to be careful is that there are a lot more surrogacy agencies, some of which aren't as experienced with surrogacy, and there is some fraud activity going on with surrogacy, so you just want to make sure you vet the agency that you're using carefully. When you're matching with your surrogate, I always tell my patients it's kind of like a matching game. You want to make sure that you and your surrogate are aligned in things such as how often you're going to be involved. Are you going to be close and very involved in the process, or are you going to have more of a hands-off approach? Most of my patients are kind of in the middle. They want to have some relationship throughout the pregnancy, but they're not going to be moving them in or having them next door. And then we have some patients who really want a transactional distance from their surrogate. So that's actually important when you're choosing your surrogate, because you want to make sure that you're going to have a smooth relationship throughout the pregnancy. The first step is going through psychological and social screening, and if you're using an agency, the agency handles that. Sometimes people don't realize how much an agency does for the process, but there is quite a bit involved administratively. There's some required screening by the FDA, and that is done often up front if we know that we're going to be using a surrogate. If we don't know that we're going to be using a surrogate, then it can be done after the fact. And they need to be done in a specific order at a specific time in relationship to creating the embryos. And that has to be done on what we call the intended parents. So the egg source and the sperm source that gets replaced into the womb of the gestational carrier. So that enables us to make sure that when we're replacing the tissue back into the gestational carrier, that we've screened the egg and the sperm, what eventually becomes the embryo, for any infectious diseases that could put the gestational carrier at risk. Then we want to do what's called a medical screening if the gestational carrier has passed those tests to complete the process. And the medical screening involves a physical examination, also to screen for what we talked about, the FDA requirements. The last step is going to be the legal, because that's the most costly and involved process. The agency or administrative clearance, getting the history, making sure social and psychological clearance is done. Then we move on to the FDA and medical, and last but not least would be legal. Once the legal clearance is done, then the surrogate can begin treatment, and treatment involves the embryo transfer process, which typically can take anywhere from 4 to 8 weeks, depending on the specific protocol that the doctor elects to use. Once the embryo transfer is done, then you wait to find out if the surrogate is pregnant. That takes about 10 days after the transfer. And then the surrogate can be monitored by either the fertility specialist, depending on where the surrogate came from. If it was from a different state, sometimes we do what's called outside monitoring. It depends on what the intended parents prefer. Oftentimes we'll be involved still to follow them through the first trimester, either locally where we see them, or they may be out of state or out of the area, but they still want us to review the records that are sent to us from an outside facility where we're still managing the hormones, hormone replacement therapy, and the ultrasound images until the patient is out of the first trimester and moving on to their OBGYN. In terms of costs, again, it really depends on where you reside, where the surrogate is, and whether or not this surrogate has gone through surrogacy before. In California, generally you're going to pay more for a surrogate, and if this person has gone through before, she'll also have a higher cost for going through. In terms of rough estimates, expect at least $100,000, upwards to $150,000, sometimes even approaching $200,000. It depends if she needs medical insurance or not. There will often be an umbrella policy, but whether or not she needs basic medical insurance can be very costly, depending on, again, what state she's in, or if she ends up on bed rest or needs child care support. The cost can add up pretty quickly. If you see that there's a low-cost surrogate, there's usually a hook in there and something that you want to be suspicious of. And so if it is too good to be true, there's probably something going on. And increasingly, we're seeing that some insurances now are offering coverage for surrogacy. Some states do mandate it. And then I'm also seeing a lot more financing, which are becoming more and more reasonable. So you may not know that, but there's options out there. If you feel like you can't afford it, there may be more opportunity than you think. So one thing I want to talk about is what people don't expect with surrogacy. I think they're surprised to know how long it might take. Most agencies won't even allow you to get on their list or on their profile until you have embryos. So you could start kind of exploring agencies, but typically there's a wait list for most agencies, although I've seen that reduced lately because there are more agencies around. But the good agencies often will have a waiting list. Remember that it might take time to find the right surrogate, so expect at least 3 to 6 months to find a surrogate and to get through all the documentation and administrative steps. For some people, it can even take longer, but in the end of the day, you want to make sure that you find the right match. So if you're wondering if surrogacy or gestational carrier is the right option for you, the first step is to schedule a consultation with your fertility specialist. You can schedule it here with us at OC Fertility. We can talk to you about the options, walk you through the steps in more detail, and answer any questions you have.